So we're talking about GI pharmacology as a suppression therapies. So there we have the ATPase, hydrogen potassium ATPase, which secretes these hydrogens and takes in the potassium. We can inhibit them by the PPIs, the proton pump inhibitors, directly. And when the hydrogen comes out, we can give antacids to sort of neutralize that hydrogens. Okay. On the other hand, we can inhibit the vagus nerves that secretes the acetylcholine on its M3 receptor by giving atropine. And vagus nerve also stimulates the gastrin, and that gastrin works on its CCK beta receptor, and in turn stimulates that ATPase, so we can. This thing we cannot inhibit, okay? But we can inhibit the major pathway that 80% of the gastrin works by working on enterochromaffin-like cells. They work on histamine. They release histamine, and that histamine works on a receptor, H2 receptor, and we can inhibit that by giving H2 blocker. So now if you were to think which is the perfect therapy, well, it looks like PPIs, they're directly going and inhibiting that channel. So that's the most effective. But if you cannot give PPI for any reason, then you can give an H2 blocker or atropine. But remember, if you're giving atropine, still this pathway is on and it is gonna work and stimulate, and vice versa. But what is protective now is the somatostatin. Somatostatin and prostaglandins both are inhibiting the cyclic AMP, which was normally stimulating the ATPase. So if you were to give somebody prostaglandin, I mean it's going to inhibit ATPase, but how strong? That's the question. And how they're going to work? That's the question. But just theoretically, prostaglandin, somatostatin, they're working. So now, since we have this thing in mind, let's talk about the drugs now. H2 blockers. H2 blockers are cimetidine, famotidine, and nizatidine. Take H2 blocker before you dine. So before you start dining, take a H2 blocker, which is going to block the pathway. Okay. It is a reversible block. Reversible block of H2 receptor leads to decrease in hydrogen secretion by the parietal cells. I mean, clinical use of, for sure, you want to use a peptic ulcer disease or gastritis or mild esophageal reflux. But adverse effects, most importantly, they are the inhibitors of cytochrome P450 enzymes. And they're also anti-androgenic effect. Okay, but since they're H2, they can cross BBB. In contrast with H1, which wouldn't cross BBB. Right? So this is going to cause sedation and sleepiness. Other H2 blockers is relatively free of these effects. Cimetidine decreases increased clearance of the excretion of creatinine. Let's talk about PPIs. Omeprazole, lansoprazole, esomeprazole, pantoprazole, dexlansoprazole. Irreversible. Very good. So look at this, important. Irreversibly inhibits the hydrogen potassium ATPase in the stomach parietal cells, Now, same thing, peptic ulcer, gastritis, esophageal reflux, Zillinger-Ellison syndrome. But if it is refractory, just you have to do a surgery. A component of therapy for H. pylori, yes, and stress ulcers prophylaxis. Adverse effect increases risk of C. difficile infections because you're knocking out the acid, C. difficile can grow. Pneumonia, acute interstitial nephritis, vitamin B malabsorption leading to macrocytic anemia or pernicious anemia. Decrease in serum magnesium calcium absorption, potentially leading to increased risk of fractures in older adults, osteoporosis. Antacids. Antacids can affect the absorption, bioavailability, or urinary excretion of other drugs by altering gastric and urinary pH or by delaying gastric emptying. All can cause hypokalemia. Aluminum hydroxide adverse effects. Wait. All of them are antacids, right? They're affecting absorption, bioavailability, urinary excretion of other drugs by altering the gastric and urinary pH. Okay, so let's talk about aluminum hydroxide. Aluminum hydroxide will give you constipation, hypophosphatemia, decrease in phosphate, osteodystrophy, proximal muscle weakness, and seizures. Aluminum amount of feces, minimum amount of feces chops constipation is the adverse effect. Constipation, minimum amount of feces. Aluminum, minimum amount of feces, constipation. While on the other hand, this guy, magnesium, will give you diarrhea. Must go to the bathroom, diarrhea. So what you end up giving, if you give both together, that counteracts each other. They're combined. So normally, in normal formulations, you combine aluminum with magnesium so that their action is counteracted with each other, and the reverse effects are crossed by each other, so you don't get constipation and you don't get diarrhea. Let's talk about calcium carbonates. They cause hypercalcemia, milk alkali syndrome, rebound acidity. Can chelate, decrease effectiveness of other tetracyclines. Bismuth sucralfates. They bind to the ulcer base, providing physical protection and allowing bicarb secretion to reestablish pH in the mucosal layer. Sucralfate requires acidic environment and not given with the PPI because PPI is going to block that acidic environment, or H2 blockers. So what is the sucralfate doing is basically putting a layer. There is an ulcer who's putting a layer on it so that there is no more damage to that nice skin or nice mucosa. Clinical use: increase in healing ulcers, traveler's diarrhea, bismuth. Bismuth also used in the quadruple therapy for H. pylori. Misoprostol, which is a prostaglandin E1 analog, increases production and secretion of the gastric mucosal barrier and decreases acid production. Prevention of acid-induced peptic ulcers. Antacids, what do? They block this prostaglandin E1 production. So you give misoprostol to prevent the acid-induced peptic ulcers. Also off-use label for induction of labor, ripens the cervix. Misoprostol ripens the cervix. Whenever you see off-label, most likely it is used there, okay? Adverse effects: diarrhea, contraindicated in the patient with a childbearing potential. Yeah, I mean, why would you want to give somebody who has a childbearing potential, right? Because it's going to lead to induction of labor. So you don't want to pre-induce someone. Okay. Now let's talk about, this is the next section. So let's talk this thing in next section.